there is no hospital offering maternity care whatsoever, and there's no OBGYN offering any kind of services whatsoever.
Y'all, happy Monday. Unfortunately, I do have to deliver some bad news about what's going on with healthcare in Alabama. So another rural hospital in Alabama has shut its doors.
Hi everyone. Today I want to talk about a shocking situation in the US. The healthcare system. Hospitals are closing. Many nurses are burning out and quitting, and in some areas, pregnant women don't even have a hospital to give birth in. This is a serious issue affecting both healthcare workers and patients across the country. What I'm sharing comes from a collection of clips I found on social media, and I want to invite you to watch them with me to get a better understanding of what is actually happening.
You guys, I'm quitting my job today. I'm scared. I've been a nurse for like 5 minutes, but I can't do it. I'm putting in my 2 weeks today, but I'm doing a week. I gotta get out of here. So I'm a new grad nurse, and I've been on my med-surg floor for maybe 7 months now, and I can't do it. I literally can't do it. I hate it. I hate it so much. And like, imagine coming to work and you have 7 patients and they're just all shit. I just can't, so I'm scared. And then I also just feel like a failure because I just started and I'm quitting already. But you know what? People are like, stick it out, stick it out. I literally cannot stick it out. Like, I have to get out of here. And it does make me feel a little bit sad. And I feel like I said, I feel like a failure. But you know what? My mental health is way more important. I will find a job that I like, hopefully. But I just know that this isn't for me. And I feel so bad.
Layoffs are happening and hospitals are closing. Here's a list of 5 hospitals I know y'all didn't know closed that closed in March and in April of 2025. First is the East Ohio Regional Hospital that closed March the 20th. Then the Mid-Coast Medical Center in Texas that closed April the 25th. Also, the Christ of Santa Rosa Hospital closed April the 20th that is located in San Antonio in Texas. United Medical Center in Washington, D.C. closed April the 15th. That's the Insight Hospital and Medical Center in Warren, Ohio that was closed down in March, and they're not sure if they're going to open back up. And there are still 4 more hospitals that are going to close in both May and June of this year. And nobody's talking about the amount of layoffs. Literally, people aren't just going from one hospital, working there, transferring to another. People are getting laid off, not having nowhere to work. Doctors that went to school for years, nurses who went to school for years, receptionists, people who have been working their jobs for no telling how long, now have no job. Like, we're not talking about it enough. I don't know what's going on. We need to be speaking on this.
If you're pregnant, or you know someone who is, or you think you might want to have a baby one day, can you give me just a couple minutes of your time? Because I have some information that you might not be aware of. Hi, my name is Kathleen, and this is Pushed Out, where I am documenting my journey looking into maternity unit closures around the United States. Did you know that 35% of the counties in the United States are maternity care deserts, which means that in those counties, there is no hospital offering maternity care whatsoever, and there's no OBGYN offering any kind of services whatsoever. That's a little crazy. So the only reason I know this at all is because last year when I was pregnant with my second child, about 2 months before my due date, I learned that the hospital I was using was going to be discontinuing labor and delivery services about a month after my due date. So it was not going to affect me. However, it was in that moment where I was like, is this legal? Is this allowed? I guess I always assumed that having a safe place to give birth was almost like a right. And it was in that moment that I realized that I guess it wasn't. And so life went on. Last February, I learned that another local-ish hospital was also going to be discontinuing its labor and delivery services. So with that hospital closing down, there was now a 7-county maternity care gap in Pennsylvania around the area that I live. And so it was then, after I heard that I was like, okay, this is insane. Like, I need to look into this a little bit more just for personal interest. It's like, is anybody going to say anything? Is anybody going to do anything? Are we just going to let this kind of continue? Like, where's this going to stop? And so I hopped right on the crazy train and read every single article that I could get my hands on just to learn a little bit more. And what I found out was that this is not a rural Pennsylvania problem. This is a United States problem, and it's happening in all areas of the United States. And so I want to tell you what I'm learning. I am not an expert. I'm not a doctor, but I am just a person that's interested in the problem that I would like to share with you and to make sure that everybody is aware of what is happening. So if you could do me a favor and follow along, give me a comment, share with a friend, do anything that you think TikTok would like just for the sake of engagement. My goal is to tell as many people about this as possible, and I would greatly appreciate any help that you can give to me.
It's honestly really sad to hear people in the profession are exhausted under so much pressure that some have to quit after just a few months because they can't handle it. Meanwhile, hospitals both in big cities and rural areas are closing one after another. This doesn't just cost doctors, nurses, and hospital staff their jobs. It directly affects patients, the people who need medical care the most. Even worse, I just learned that some areas have become what they call maternity care desert, meaning pregnant women literally don't have any hospitals to give birth in. For a country as a developed country like the US, that's really concerning. Listening to nurses talk about burnout, being laid off, in toxic working environment, I feel like they're facing way too many disadvantages, even though they are the front line of public healthcare.
So, to everyone who saw my I Hate Nursing video, and if you didn't, hi, I'm Margaret and I hate being a nurse. I just wanted to come on here and let you guys know that I have officially put in my resignation and quit my job. I honestly couldn't be more happy. I am going to be transitioning into clinical research. And honestly, if this does not work out, it sounds like it's going to be a pretty cool opportunity. But if this doesn't work out, I'm done with nursing. This is my last chance. And honestly, a lot of your comments are kind of what got me here and gave me the confidence and like push to really change my life. So I just want to thank everybody who came on here and supported me and validated my feelings. And I just want to send you guys all my love and I'll keep you guys posted.
Glenn Medical Center in Willows, California just announced it will close its emergency room within 60 days, with the rest of the hospital shutting down soon after. This comes after CMS revoked its critical access hospital designation. For nearly 25 years, this designation allowed GMC to be reimbursed at 101% of its cost by Medicare, which is often the difference between survival and closure for small rural hospitals. The reason? CMS determined the hospital is 32 miles away from Calusa Medical Center, just 3 miles short of the 35-mile federal requirement. Without that designation, the hospital loses vital funding and regulatory flexibility. For the residents of Glenn County, this isn't just about numbers. This hospital has been serving the community for 75 years. Losing it means longer travel times for emergency care, fewer inpatient options, and more strain on nearby hospitals. This story underscores a harsh reality. Technicalities and federal rules can determine whether a rural hospital lives or dies, and ultimately, whether patients survive in emergencies.
Well, I've seen that all the hospitals and stuff are shutting down. And it's no cap. 3 has shut down in my area, and I live in a little small town. So I know it's facts. What if they're trying to shut down all the hospitals, start some shit, and then introduce that new Neuralink? Like, oh, we might not have the supplies because of the stuff that's going on with Hong Kong, but we got this Neuralink that'll fucking heal you. What if they do that? I'm just trying to figure out why are they doing this shit that they're doing? Because it's like, it makes no sense.
You know, we talk a lot about resilience in medicine, but no one talks about the conditions we're expected to be resilient in.
Nurses are taught to care for everyone, but we're still stuck in a system where nurses are eating their young, bullying, burnout, and even shame if you speak up.
We train in toxicity. We're told that exhaustion is just part of the process, that breaking down is somehow a rite of passage.
All of this trickles down to patient care, and when we're not well, our patients are not safe. Period.
And it's not just about them, it's about us. Mental health matters. Our safety matters. We keep pretending we're fine, and the culture will never change.
Nothing changes if nothing changes. That includes how we treat each other, how we mentor, and how we lead as well.
It starts with us creating a culture where it's safe to say, I'm not okay, where kindness is policy, not a personality trait.
So here's the challenge. Be the coworker you wish you had when you started. Protect your peace like you protect your patients.
Because healthcare won't heal until we do.
I got ready for work this morning and I sat down on my bed. And as I'm sitting on my bed, I'm like, oh my God, I don't want to go to work today. And it should not be like this because I love my job. I love the people I work with. I love everything about what I do. I think people feel like this every day in any type of job they have. I don't think it's just in nursing. I think as a population, the general public, which includes me, has gotten a little less patient with everybody. And we've thrown like common courtesy and respect to the wayside. It's like whatever we think and however we feel is the most important thing, and how others are treated doesn't matter as a consequence. And as a person who was raised in the South by a very Southern mother, that just goes against everything I was brought up to believe in. Now, she didn't teach me to self-sacrifice. She didn't say, do something for other people that ends up hurting you. She never said that. And I know a lot of y'all that aren't from here think that that's what we mean when we say things like that our mothers taught us to be courteous and genuine and happy and easy to get along with. Y'all think it means that they told us to self-sacrifice and that others meant more than we did. But I think society has now flipped that. And it's all about me all the time. So when a nurse is down the hallway taking care of 10 to 20 patients and you're on the call out for your mother, and when she finally gets to the room because she was doing something for another patient that was a priority at the time, when they finally get in there with the mother and you're cussing everybody out, the nurse being rude in their face and all that because they didn't come fast enough to get to your mom, you've lost the ability to see that your mama's not the only person there, that there are other people there that need care as well. And I'd say the same for teachers, that people think their kid is the only one that matters and they want the issue with their kid taken care of right then. I see a lot of my teacher friends talking about things like that and relating to things that I say about nursing because they're dealing with the public too, just in a very different situation. And more power to them, because I'm telling you, I could not be a teacher. I couldn't work with young kids and their mothers or parents. It's hard enough dealing with family members. And I do understand that when your family member is sick, it's stressful for you and you want everything taken care of right then. But sometimes it just can't be like that because you're not the only person there. Your mom's not the only person there. Your dad's not the only person there. Your grandpa's not the only person there. And then there's a whole nother conversation we need to have about aging and disease process and whether or not we should be doing CPR on a 99-year-old woman that has terminal cancer and cracking her ribs all up. That's just my opinion and my experience. But anyway, where did common courtesy go, y'all? Where did common courtesy go? Because that's what makes me not want to go to work. It's not my job. It's not my coworkers. It's not my boss. It's not the buildings that I walk into. It's none of that. It's the lack of common courtesy from people and people's family that I'm going to be taking care of. And I know there are a lot of nurses that feel that way because we have this conversation all the time. I just wish as a society we could get back to courtesy and respectfulness, but I don't know if we're ever going to get there.
Right on the heels of National Nurses Week, New York Presbyterian Hospital has announced its plans to lay off about 2% of its workforce, which equates to about 1,000 employees. Don't know yet exactly what the breakdown of those employees is going to be, but we do know that it includes nurse practitioners and nurses. They are allegedly laying off all of their nurse practitioners except the ones that were hired before 2010 and have allegedly already laid off 50 RNs from the Columbia campus, from what I'm told. But are they not still building a new cancer center and enlarging another hospital? But they're citing financial difficulties. Why? Why are they having financial difficulties? That's a great question. I'm glad you asked. Last week, Columbia University and New York Presbyterian Hospital announced that they have settled a massive class action lawsuit for $750 million involving 576 patients that have accused an OBGYN by the name of Dr. Robert Hayden of sexually assaulting them between 1987 and 2012. But wait, it gets worse. According to federal investigators, Columbia University knew about this for years and years and continued to allow the OBGYN to work for years as patients continued to come forward. Finally, in 2020, federal investigators began investigating. And they have alleged that Columbia University failed to inform the DA when more patients continued to come forward and that they withheld evidence. And to date, as far as anyone knows, no one with Columbia University and New York Presbyterian, none of the employees there have been terminated or resigned in the wake of this. He was finally sentenced in 2023 to 20 years in federal prison, thank goodness. But Columbia University, they have not had to admit any fault whatsoever. But they're now paying out $750 million in settlements while they let him continue to do harm, to actively harm patients. And now, as the trickle-down effect, nurses and nurse practitioners and other healthcare professionals are being laid off. If that doesn't piss you off. The epitome of corruption. And this is not an isolated incident. Stuff like this happens all the time. They always cover it up, especially when it's a doctor.
Okay, so we're back for another TED Talk. This is something that I have been thinking about for a while now, and I feel that a lot of people might be in the same boat as me. I have been in the ER for over 3 years now, and I am just at a point in my life where I just feel stuck, and I just know where I am, I'm not supposed to be or supposed to be there for too much longer. And I'm juggling going back and forth with going back to school for my nurse practitioner or just leaving healthcare altogether and doing something completely different. Or leaving the ER and doing like something outpatient and something that's less stressful and just more slower paced. And I know that God has it all figured out for us and he just wants us to be patient and he'll show us where we need to be. But just sometimes it's so hard to be patient in his plan. And I also wanted to know what everybody else does for work. And if you really love your nursing job, let me know what you do and if it's something I can look into. If it's something outpatient or if you just really enjoy your job, comment down below what it is so I can know. So yeah, this has just been something I have been thinking about for a while now. And if you're in the same situation as me, just know that you're not alone and we will figure it out eventually. If you're going into work today like me, I'm sending you all the good vibes and I hope that you have a good shift. Okay, bye.
I start college in August, obviously. Why did nobody tell me that you can still be in debt while going to community college? I went to community college to avoid debt and I'm still going to be in debt. So, with that being said, I will never be buying anything that I don't need ever again. Here's my coffee that I made today from home. Will never buy a coffee again. Just kidding, I'm lying. But, I can't just go around spending money anymore. Anyways, yeah, that's my thought of the day.
I can't even believe I'm about to say this, but it is truly one thing that I hate about nursing. So if you've been watching my page, 2 weeks ago, my grandmother passed away. And the thing that I didn't think about, like becoming a nurse, and I don't know why it just never crossed my mind, is that I feel like we are the first people to know when our family member is about to go. My grandmother's death was very sudden. She had an appointment that morning to get her dialysis catheter replaced. The replacement was successful and she coded. My grandmother raised me, so this is something that I knew was going to happen, but it's something that I wasn't prepared for mentally. But when I went to the hospital and seen my grandmother and looked at her, my nursing intuition went off first and I just knew that my grandmother was gone. It sucks. It really sucks.
This time last year, the residents of Unicoi County, Tennessee were still proud of their 4-year-old hospital, Unicoi County Hospital, which had been built by Ballad Health in 2018. And then Hurricane Helene hit. And 2 days after it made landfall, 54 staff and residents of the hospital, including about a dozen rescue staff that had come on fast boats, had to be airlifted via helicopter from the roof of the hospital. And the hospital is yet to rebuild. The estimated cost to rebuild it is now in excess of $50 million. And FEMA and the state of Tennessee have contributed about $9 million. But thanks to the massive Trump bill that just passed, well, it now looks like the hospital won't be rebuilt, leaving Unicoi County residents without a hospital. And Ballad Health, that operates more than 30 rural hospitals through Tennessee, North Carolina, and Virginia, is now saying by the end of 2028, they'll likely be losing $125 million a year, where they had just begun to operate in a $30 million a year operating profit that they were turning towards opening more hospitals in rural communities. Thanks to the Trump mega bill, more rural hospitals are going to continue to close, and this story is going to be repeated around the nation, particularly in red rural states.
After all, I think this isn't just a healthcare problem, it's a social problem. If nothing changes, patients will be ones paying the price first. And I really hope more people pay attention to this situation. And that's it. Thank you so much for listening to my thoughts. And I hope together we can get more perspectives and speak up for those quietly bearing these challenges. And see you in the next video. Don't forget to subscribe to my channel.